Hello guys, welcome to our channel. Today we are going to discuss about the FMG exam day strategy and what are the do's and don'ts in the examination hall and how to proceed in the answering the questions and image-based questions and non-clinical questions we are going to discuss. So I hope you're all doing well in your preparation also. So just one day to go guys, and pretty confident all you are had the best preparation in the last 6 months. So your hard work is all going to pay off for you. Okay, all the best everyone. So let's start the video. So first thing that we all know, everything is hard. Before we are going to do this, everything is hard. We have gone to the FMG land, like foreign medical graduate. We went to the abroads, different countries, Philippines, China, Ukraine, everything. So we all got there and we completed our MBBS. We never thought we are going to clear this examination. Yes, we did. And we graduated there, right? We already graduated there and we came here. And now we are appearing for this FMG examination. And one day, this is also hard now. It may be hard now, but one day this is also going to be easy. So everything like that. Next, after this, we are going to proceed for the NEET. After this, we are going to proceed for the MD and super specialty. And after this, we are going to see much more races in the life. Life is like a race only. So everything is hard until we know it is easy, until we are already done it. So never think that something is hard, you are not going to do it. You can do it, you will be doing it. Okay. Next. So what are the first things that you have to keep in your mind? What is the thing that you have to do? Have the good sleep, guys. Because see, now you are going to travel for the examination center, and now you are going to make sure that travel huddling all with your family, financial, everything, you will be stressed. So make sure that you are getting the good sleep on that night. Okay, at least 5 hours, 6 hours. That is very good for the exam day. Because if you does not have this adequate sleep now, you will be feeling the drowsy, anxious, confusing with the options, feeling the tense. Everything will be going on with you. So to avoid that, have some good sleep. At least 6 hours is very important for our exam knowledge. And next, coming to the eat light and balanced meal. Don't go for the biryanis, masalas, or some other street food, because suddenly it may cause the diarrhea for you, or it may be discomfort for you in the examination hall. So like for that, have the some light balanced meals only, like chapati, fruits, shakes. Something is better. Okay, but unless you having the street food, that will be the acidic reflex. Everything will be hurdle for you. Next, stay hydrated, because our brain need glucose and water. That is very important. So please stay hydrated, because we are going to use our brain for at least 6 to 7 hours. Right. Next, what is the other things that you have to carry? Don't forget to carry your admit card. How you are going to carry that? Front side, front side and the back side in one paper only, that you have to carry. Admit card, the two color. Better carry the color xerox. Next, ID at least. So they will be mentioning that one ID is enough, but try to carry the passport and Aadhaar card both. Okay, because it is India. So Aadhaar card is important. As we are FMG, passport also will be useful for you. Next, especially don't forget to carry. What that could be the especially don't forget to carry. So you never forget to carry your confidence, okay, which is more important in your examination hall. You need this confidence to attempt 300 questions, guys. Okay, so make sure that you are going to have that courage to carry this confidence in the examination hall. Yes, sitting here and telling to carry the confidence on that stress day is, yes, same. I have also experienced. But if you carry this confidence now, you will be seeing that 300 questions also, like a one more GT that you are giving in some telegram, giving in some app. Okay, so please do carry that confidence in the examination hall. Next, reach the center as early as possible. Now this time, this is on the Saturday. You may feel the weekends only, but less traffic. But still, try to manage. You are going to reach the early as soon as possible, at least 1 hour before, to avoid the traffic and everything. Lines will be there, checking all this now. So at least 1 hour prior is important, guys. Next, in the examination hall, don't panic. Be confident. Okay, first thing. So first set, in the first set, you will be seeing that 2 to 3 questions that you don't know. Yes, immediately you will be panicking. Don't do that, guys. Okay, don't just panic about this one. Okay, be confident. Yes, there's 2 to 3 questions. Okay, you don't know, but you know at least 250 questions you may know, or else 200 questions you may know. Okay, never is a late. Okay, sky is the limit, never is a late. So 200 questions you may know, 150 questions you will be correct, and 180 you will be scoring. Like that, be confident. Don't panic just by seeing the 4 to 5 questions. You don't know those questions. You are seeing the first time. You haven't revised the topics, but suddenly came up pop up on your screen. Never just panic about this. Okay. Remaining 200 questions now, you may know. I'm telling you now 300 questions. In the 300 questions, at least 150 questions are PYTs only. And 50 plus questions known topics only, guys. Okay, known topics only, which are repeating from the past 5 years of the FMG examination. It's never a new questions. Maybe 50 questions, maybe these 50 questions are new, but remaining the 200 plus questions are always same topics that is coming from the past so many MBBS years, NEETPG, INSD, all this also same known topics only. Okay, don't panic. Next one, read the question carefully. Don't rush. Okay, read the question carefully, whether it is a one-liner, whether it is a clinical question, or whether it is a even image-based question also. Read that question properly. From 1 to n point, you have to read. Okay, that is the first thing. Don't rush. You have the plenty of time. You have the 6 hours, guys. Don't just run back to what is the left. You have to write immediately. You have to attempt that immediately. You are confusing with the one option. You are confusing with the two options. Don't do that. Don't rush. Read the question properly. Read the options properly. You will be easily answering that questions. Okay. And attempt what you know first. Instead of you are just staying at the one question and you are using your entire time between the two options, you better go and attempt the known question. That will be easy for you. And you will be having the plenty of time to spend that with that question afterwards. So do attempt that, because see, this is the time bounded examination. We have the time bounded examination. You have to make sure that you are going to attempt the known topics that you have read already, revised well. Okay, don't waste your time on the unknown questions. Next, do attempt all 300 questions. Why you have to attempt these 200 questions? You don't know. You will be having the fortune with one question, two questions also, because one question is equal to 300 marks also. Okay, so fortunately we don't have the negative markings. So that's why attempt the 300 MCQs. Never lose the one question, two questions also. It may be lucky for you also. Okay, that one you have to remember. Let's see how to answer these kind of questions. For example, you will be seeing the 5 lines of this question, big unknown options. You will be suddenly having this panic attack. What is this question and how to answer this one? Okay, that anxiety will easily give you the panic, guys. Don't feel that. Just whenever you see the clinical question or the big question, read this one last line. Okay, read this one last line. Which of the following is the most likely diagnosis? So read this one last line, and after that you can go for that question. For example, here you can see which of the following is a diagnosis. He is not asking about the antibodies, treatment, diagnostic step, what is the next step. He is just asking what is this diagnosis of this disease. So 58 years old man presents with the progressive fatigue, pruritus, right upper quadrant. Okay, this could be the liver disease. And now he elevated alkaline phosphatase. Yes, it is confirmed that is a liver disease. And positive anti-mitochondrial antibodies. Okay, most likely autoimmune disease. Liver biopsy shows the granulomatous inflammation interlobular bile ducts. Okay, yes, this is the sure shot. This is the this is the liver disease condition, autoimmune condition. Now coming to the options, go with the elimination process. What is the elimination process? See which options are related to our questions, which of the options are not related to our question. Here the options are primary sclerosing, primary biliary, chronic hepatitis, alcoholic hepatitis. So is it alcoholic hepatitis? Anyone is there given the alcoholic history? No, this is not our option related. Chronic hepatitis B, is there any history? Is there any hepatitis antibodies or the antigens? No. So this is also not our options. It could be primary sclerosing or the primary biliary cholangitis. If you know the antibodies most commonly asked, you can answer easily. Or if you know the understanding of the question, liver biopsy showing that there is a granulomatous inflammation interlobular bile ducts. So this is coming from the biliary tree itself. If you know by the logic or if you understanding by the question also, you can easily answer this question. Okay, so this is likely to be primary biliary cholangitis. Okay, go with the elimination process, go with your logic, go with the concepts. You can easily answer these questions. And 58 years old age people will be having this biliary. And these classic conditions like primary sclerosing, females, young patients, family history, that will be having in the primary sclerosing cholangitis. And always see the buzzwords. What is the examiner is asking? Buzzwords, you have to go with that instincts. Next, which of the following statements are beta blockers is not true? So the question is here asking one liner only, but sudden in the rush, you will be forgetting this not. You will be not seeing that not. Okay, simply you are just going to see which of the following statements is true. Don't do that mistake. Here I highlighted the not in the capital and the bold letters, but examiner is not going to have that. So always look for this except, not, which of the following is not, and what is the next step. These kind of questions you have to read properly. Now go with the options again, elimination process. What is the beta blocker properties? they reduce the myocardial oxygen demand. So now you have to think, whenever the patient is having the myocardial infarction, whether you give the beta blockers or not. Yes, we are going to give. Along with the MON, like morphine, oxygen, nitrate, and antiplatelets, we are also going to give the metoprolol. Why? To decrease the blood pressure, to prevent the also arrhythmias, and also maintain the heart rate of this patient. Yes, this is also true statement. What we have to find, not the true statement of the beta blockers. Next, they are contraindicated in the severe asthma. Obviously, because of the beta receptors present in the lungs, we are not going to give in the asthma patient. They mask the hypoglycemia symptoms. Yes, this is also true statement because beta receptors present in the pancreas also. And next, they increase the renin secretion. So what is the main mechanism of the beta blockers? We have to decrease the blood pressure, decrease the heart rate. Here, if you increase the renin secretion, obviously it will increase the aldosterone, further BP is increased. So this is not increase, instead it is decrease. So this is our false statement and answer for this question. So like that, go with the options and elimination process with the question. Next, a 76 years old woman presents with the emergency department, palpitation, shortness of breath, blood pressure 130/80 and pulse rate 120. ECG is given. And what is the diagnosis of the ECG? Again, go with the last line of the question. What is the diagnosis of the ECG? Now, look at the ECG. Here you can see this is having the irregular, right? And also patient is having the heart rate. This could be conditions of which one, guys? Obviously, heart blocks you will be getting into the mind. And also patient might be having the AFib or SVT or some of the tachyarrhythmias could be ruled out first. So whenever you see the image based question and see the what is the question is asking about, and now go with the image first. Okay, always look for the image and then the options. In this image, always look for the image and their related options. Here they're asking about the atrial fibrillation. What is the features of the atrial fibrillation? The patient will be having the heart rate high, and this heart rate also irregular, and P wave is absent. Okay, P wave is absent in this patient. Next, coming to the SVT, here also heart rate is increased, and same this patient also P wave is absent. But what is the difference between these two conditions? Obviously, this will be in the regular condition. Morbid's type 1, Morbid's type 2, P wave is present, but there will be having this different condition. What about this one? So if you see this image now, is there heart blocks? How the heart blocks will be? PR interval is going to prolong, but there is no PR interval. All the PR intervals are constant only, but now coming to the P wave, absent or present. So here you can see the QRS complex. Here you can see T wave. But where is the P wave? The P wave is absent here. So this is not likely to be the Morbid's type 1 or the Morbid's type 2. And what could be AFib or the SVT? Now coming to the history, irregular. So likely to be this option is the atrial fibrillation. So whenever you see image and option should be correlated with their features. So like this, don't make the mistakes. And what are the don'ts on the examination day? Don't skip the sleep, don't skip the breakfast, because energy, glucose, water, that is important for the focusing on the examination day. All right, next, don'ts. Don't discuss the topics, answers just before the examination. You might meet your friends, you might meet your college mates and center mates, everyone, but don't discuss about the topics and answers. Guys, I have read this some in my institute and I'm thinking this could be the answer. Guys, this might be the controversial answer. Don't think and don't discuss this type of answers. Okay, just discuss about what you had, what you are thinking, what just like that only. But don't discuss about the exam topics. Okay, and don't discuss about the paper 1 before the paper 2. This will also give you the low confidence and your mood will be changed. Array, that I have made this mistakes, that I have done this mistake, like that. So don't discuss about the paper 1 before the paper 2. All you have to do this complete papers and then only discuss about it. Then only see the what is the paper analytics, what is the evaluation. Okay, never discuss before the examination. Next, don't change the answers repeatedly. I might have seen so many students will be telling 149 they stuck or the 148 they have stuck. What their common mistake? Changing the answers repeatedly. They are going to coming the before slide and changing the answer. Coming to the before slide, changing the answer. Don't do that. Never make the mistakes like changing the answer. You will be stuck between the 149 and 149. Okay, whatever you are trusting your instincts now, immediately mark that one. Okay, that is going to help you a lot. Next, don't blindly mark the unknown or the new options. So as I said now, if you see the one of the question, they're given the Broca's aphasia. And another option is the vernicase aphasia. Another option is the instead of the Broca's vernicase, which is the commonly asked, they now given the Hegri, or they given the Zedol. So you don't know these aphasias or you don't know these pathways. Okay, these are the new options. Never go with the logic. Hey, this might be the examiner is asking us. Okay, this might be the new options. That is our answer. These terms is not even present in the MBBS itself, and CNS not even present. So don't go with these new options thinking that these might be the answer. Okay, if you know now these two options, think whether this can be related at least 70% or not. Probability these two only the answer. Okay, don't blindly mark the unknown or the new options. Mostly the known options only the answers of our examination. Next, don't waste the time on one question. Red flags, move on. Okay, if you see the red flags, this might be confusing you. This might be thinking you, this you might lose the mark. Never wait for that. Never waste the time on that one question. Okay, immediately move on to the next question. That is your answer. And remember, this is the time bounded. You may have the 4 sets or you may have the 5 sets. All these are time bounded. You can't go back to the previous set and change your answers. Just think about the instinct answer. Just think about your revision plan, recall, and give the answer. Don't lag, don't make the time waste, and write answer properly, and don't change the answers. Okay, don't panic. It's okay if you leave the guess some questions. Okay, if you're thinking here, as I said, wasting the one question, moving to the next question beneficial, but instead, even though if you feel that you are leaving that question also, don't panic. Array, I missed that question again, I might miss in the next question. Don't think like that. You can answer that also. Okay, don't get stressed or the new anxious attack when you see the new unknown topics. As I said now, 200 questions you will be knowing, and 50 questions, yes, no one knows, and remaining 50 fortune. Okay, so don't think like that. 200 questions, I am pretty confident all are known topics only. Next, don't lose your confidence, guys. What I said, please carry this one with you in the examination. This is going to help you a lot. 100% you will be getting the best results if you carry this one. Okay, you train almost a half a year. Now it's time to show what your potential of. Now you have to show how much the FMG examination by FMG has cleared this examination in very first attempt and very next attempt. And even if they are trying the multiple attempts also, they gave their best attempt now and they cleared this examination. Next, you are all going to see the very beautiful life internship and everything is going to be with you. Okay, so please give your best in this examination. So remember that it always seems impossible until it's done, right? We don't know that whether it is going to done or not, but it will be impossible only. But once you are thinking it can be done by you, it will be done. Okay, so all the best, give your best in this examination. I hope you're all going to clear this examination the very first attempt better and coming with the very best results. And last time I have said that FMG result should be not only the exam results and also the pass percentage. Yes, that happened in the last year and also expecting for the this year also. Advance congratulations and all the best. Give your best.